Welcome back to the channel. Today we're diving into an incredibly important topic that could potentially save lives: early symptoms of cancer that might go unnoticed. Cancer is a group of over 100 diseases that occur due to the irregular multiplication of cells in different parts of the body. The key to successfully treating cancer is catching it early, but many of its initial symptoms are easy to overlook. In this video, we'll be going over some of the most common early warning signs that could indicate the beginning of cancer without you even knowing. These symptoms can appear in various parts of the body, such as the lungs, liver, pancreas, colon, and more. Recognizing these signs early on could drastically improve the chances of successful treatment, so it's crucial to stay informed. If you notice any of these symptoms, it's important to consult a doctor immediately. Early detection is often the difference between a simple treatment plan and something more severe. Before we get started, if you're interested in learning more about the symptoms and causes of cancer, make sure to hit that like button. And if you're new here, don't forget to subscribe to the channel and turn on the notification bell so you never miss any of our health-related content. Let's jump right into the symptoms you should be aware of to protect your health and that of your loved ones. Number 1. Unexplained weight loss. One of the most alarming early signs of cancer is unexplained weight loss. This refers to a significant loss of weight without any changes to your diet, physical activity, or lifestyle. If you lose 10 pounds, 4.5 kilograms or more within a short period, typically within 6 months, without trying, it could be a warning sign of an underlying health issue, including cancer. Unexplained weight loss is often associated with cancers of the pancreas, stomach, esophagus, or lungs. This happens because cancer cells use up a lot of the body's energy and can alter how your body processes nutrients. As the body fights to cope with the disease, it might burn more calories than usual, leading to rapid weight loss. In some cases, weight loss can also be a result of the body's immune response to cancer. The immune system releases chemicals called cytokines, which are meant to fight cancer, but can also cause muscle and fat breakdown, contributing to the weight loss. While it's normal for weight to fluctuate, sudden, unexplained weight loss, especially if it continues over time, shouldn't be ignored. It's one of the body's ways of signaling that something may be wrong. If you notice a significant drop in your weight without a clear reason, it's important to consult a healthcare professional as soon as possible. Early detection can make all the difference in effectively treating cancer. So paying attention to your body's signals like unexplained weight loss is critical to catching serious issues before they progress. Number 2. Persistent fatigue is another early symptom of cancer that often goes unnoticed. Unlike normal tiredness, this type of fatigue doesn't go away with rest or sleep. It's a deep, overwhelming sense of exhaustion that persists, even if you haven't been physically active. If you find yourself feeling tired all the time, struggling to complete daily tasks, or unable to recover energy despite getting enough sleep, it could be a sign of something more serious. Persistent fatigue is commonly associated with cancers like leukemia, colon cancer, or stomach cancer. Cancer cells consume a lot of the body's energy, leaving less for normal bodily functions, which can lead to this chronic exhaustion. In some cases, the body's immune response to fight cancer can cause fatigue as it releases chemicals that alter your energy levels. Additionally, certain cancers can cause anemia, a condition where your red blood cell count is low, reducing the oxygen supply to your tissues. This lack of oxygen can result in feelings of weakness and fatigue, which can worsen over time if left untreated. While fatigue can be caused by various factors like stress, lack of sleep, or a poor diet, persistent fatigue that doesn't improve with rest or lifestyle changes should not be ignored. If you're feeling constantly drained without a clear explanation, it's crucial to consult with a healthcare professional to investigate further, as early detection of cancer can significantly improve the chances of successful treatment. Number 3. Fever is another key symptom that can signal the presence of cancer, particularly in its early stages. Fever is the body's natural response to infection or illness, but when it occurs frequently or without an obvious cause, it may be a sign of something more serious. Persistent, unexplained fevers are often associated with cancers such as leukemia, lymphoma, or cancers that affect the immune system. Cancer can cause a fever when it disrupts the body's normal functioning, prompting the immune system to release substances that raise body temperature in an effort to fight the disease. Additionally, some cancers may interfere with the body's ability to regulate temperature, leading to frequent or prolonged bouts of fever. In some cases, fever can also be a side effect of the body's reaction to cancer treatments. But it's important to note that fever can occur even before a cancer diagnosis is made. Unlike typical fevers from infections, cancer-related fevers may be more subtle and persist for weeks or months. They often come and go and may not always reach high temperatures. If you notice recurrent fevers without a clear cause, such as an infection or a cold, it's important to see a healthcare provider to determine the underlying reason. While fever is a common symptom for many conditions, when combined with other signs, it can be an early indicator of cancer. Early detection is critical for successful treatment, so don't ignore persistent or unexplained fevers. Number 4, skin changes are one of the most visible and often overlooked symptoms of cancer. Our skin can tell us a lot about our overall health, and certain changes could be early signs of cancer. These changes can include new growths, sores that don't heal, or alterations in the appearance of moles or freckles. While many skin conditions are benign, it's essential to be aware of potential warning signs. One of the most notable skin changes linked to cancer is the development of unusual moles or spots. If a mole suddenly appears, changes in size, shape, or color, or if its edges become irregular, it could be a sign of skin cancer, including melanoma, which is one of the most serious types. Melanoma can spread quickly if not caught early, making it vital to seek medical advice if you notice such changes. Skin changes aren't limited to just moles or spots. Yellowing of the skin and eyes, jaundice, may indicate liver or pancreatic cancer, while darkening of the skin or an unexplained rash could be tied to other types of cancer. Dry, itchy patches or persistent sores that don't heal can also signal underlying cancer, particularly if they occur on exposed areas like the face, neck, or hands. While many skin changes are harmless, it's important to monitor them closely. If you notice any unexplained or sudden changes, especially if they persist over time, consult a doctor to rule out the possibility of cancer. Early detection of skin-related cancers can significantly improve treatment outcomes. Number 5. Lumps or thickening in certain areas of the body can be one of the earliest and most noticeable signs of cancer. These abnormal growths often occur in soft tissues and can be felt under the skin, such as in the breast, testicles, lymph nodes, or other areas. While not every lump is cancerous, any unusual swelling or thickening that appears without a known cause should always be evaluated by a healthcare professional. Breast cancer is one of the most common cancers associated with lumps. A painless lump in the breast or underarm area may be an early sign of breast cancer. However, lumps can also develop in other areas, such as the neck, groin, or abdomen, and may indicate cancers like lymphoma, thyroid cancer, or soft tissue sarcoma. Lumps or thickened areas may not always be painful, but they can be firm or grow over time. In some cases, these lumps are benign, like cysts or fatty deposits, but persistent growth or lumps that don't go away after a few weeks should be taken seriously. Cancerous lumps often feel hard and immovable under the skin, unlike benign lumps that tend to be softer and more flexible. If you notice any new or unusual lumps, particularly ones that continue to grow or change over time, it's important to seek medical advice. Early detection and diagnosis are key to effectively treating cancers associated with lumps, so paying attention to these changes in your body can make a significant difference in treatment outcomes. Number 6. Changes in bowel or bladder habits can be one of the most noticeable signs that something may be wrong with your body, potentially indicating cancer. While everyone may experience occasional digestive or urinary issues, persistent or unexplained changes in your bowel or bladder habits should not be ignored. These symptoms are often linked to cancers of the colon, bladder, or prostate. In terms of bowel habits, signs such as chronic constipation, diarrhea, or a sudden change in stool consistency could point to colorectal cancer. Additionally, if you notice blood in your stool or a persistent feeling of incomplete bowel movements, it is crucial to see a doctor right away. These changes may result from a tumor growing in the digestive tract, blocking the normal flow of waste. Similarly, bladder habits are also important to monitor. If you experience blood in your urine, increased frequency of urination, or pain while urinating, these could be signs of bladder or prostate cancer. Difficulty starting or maintaining a steady stream of urine may also indicate a potential issue, especially in men. While changes in bowel or bladder habits can result from a variety of non-cancerous conditions like infections or dietary changes, persistent or unexplained symptoms lasting longer than a few weeks should prompt a medical evaluation. Early detection of cancers related to the bowel or bladder can lead to more effective treatment, so it's essential to act on these signs promptly. Number 7. Chronic cough or hoarseness can be an early warning sign of cancer, particularly cancers affecting the lungs, throat, or voice box, larynx. While a cough or a raspy voice may seem like minor symptoms, if they persist for more than a few weeks without improvement or a clear cause, they could indicate something more serious, including cancer. A persistent cough, especially one that doesn't improve with medication or rest, could be an early sign of lung cancer. It's important to pay attention to any cough that lasts longer than 3 weeks, particularly if it's accompanied by other symptoms such as chest pain, shortness of breath, or coughing up blood. These symptoms may result from a tumor obstructing the airway or irritating the lung tissue. Hoarseness or a change in voice can be linked to cancers of the throat, vocal cords, or esophagus. If your voice becomes persistently hoarse or raspy without an obvious cause, like a cold or vocal strain, it's essential to get it checked out by a healthcare provider. A tumor pressing on the vocal cords or affecting the nerves that control the voice box can lead to these changes. While coughing and hoarseness can be caused by less serious conditions like infections or allergies, it's crucial not to ignore them if they persist. Early detection of cancers related to the respiratory system can significantly improve treatment outcomes. So don't hesitate to seek medical advice if you experience these symptoms. Number 8. Difficulty swallowing, also known as dysphagia, can be a troubling symptom that may indicate the presence of cancer, particularly cancers of the throat, esophagus, or even the stomach. While occasional swallowing issues are normal, persistent or worsening difficulty in swallowing, especially over several weeks, should not be ignored. In cancers of the esophagus or throat, tumors can obstruct the passage of food or liquids, making it painful or difficult to swallow. You might feel as though food is getting stuck in your throat or chest, or you might choke or cough during meals. This can result in weight loss and malnutrition over time, as eating becomes increasingly uncomfortable. In some cases, difficulty swallowing is accompanied by other symptoms, such as chest pain, frequent heartburn, or unexplained vomiting. These may also be signs of esophageal cancer, which is often diagnosed in the later stages, making early detection crucial. While dysphagia can be caused by less serious issues like acid reflux or a throat infection, persistent problems with swallowing, especially when paired with weight loss or pain, should be taken seriously. If you or someone you know is experiencing ongoing swallowing difficulties, it's important to consult a healthcare provider as soon as possible. Early detection can improve the chances of successful treatment, particularly for cancers affecting the digestive or respiratory tracts. Number 9. Unexplained bleeding can be a serious symptom that may indicate cancer, particularly in the later stages, but it can also appear early in certain types. Any abnormal bleeding that occurs without a clear cause should be addressed immediately, as it could point to cancers of the digestive, reproductive, or urinary systems. For example, blood in the stool can be a sign of colorectal cancer, even if it's not visible to the naked eye. Bleeding from the rectum, or the presence of dark, tarry stools, often indicates bleeding in the digestive tract, which requires immediate medical attention. Blood in the urine could be a warning sign of bladder or kidney cancer. It might be noticeable or only detectable through lab tests, but in either case, this is an abnormal symptom that shouldn't be ignored. Women should also be aware of unexplained vaginal bleeding, especially between periods, after menopause, or after sexual intercourse. This could be an early sign of cervical or uterine cancer. In some cases, coughing up blood may point to lung or throat cancer, especially if it is persistent and not linked to a recent illness or infection. Bleeding from the gums or frequent nosebleeds might also be connected to blood cancers like leukemia. Although unexplained bleeding can result from various conditions, including infections or benign growths, it's important to see a doctor to rule out cancer. Early detection can significantly increase the chances of successful treatment, especially when abnormal bleeding is involved. Number 10. Severe, unexplained pain can be an early or late symptom of cancer, depending on the type and location of the disease. While pain is a common occurrence for many reasons, cancer-related pain is often persistent, worsening over time, and not linked to any apparent injury or physical strain. If you experience prolonged or increasing pain without a clear cause, it could be a signal that something more serious, such as cancer, is affecting your body. For instance, bone pain could be a symptom of bone cancer or cancers that have spread to the bones from other parts of the body. This type of pain often feels deep and aching, and it may worsen at night or during activity. Back pain can be linked to pancreatic or ovarian cancer, while persistent headaches may signal brain cancer, especially if they become more frequent or intense over time. Pain caused by a tumor pressing on nerves, bones, or other tissues can be sharp, aching, or even throbbing, depending on its location. Some cancers, like testicular cancer or certain types of sarcomas, may cause localized pain that seems unrelated to physical activity. Though pain can stem from many non-cancerous conditions, it's important to seek medical advice if the pain is severe, lasts longer than expected, or continues to worsen without explanation. Early detection is crucial, and addressing severe, unexplained pain promptly can lead to more effective treatment if cancer is involved. Cancer can result from various factors such as smoking, excessive alcohol consumption, poor nutrition, obesity, and chronic stress. Genetics also plays a role in increasing cancer risk. Additionally, exposure to harmful chemicals, excessive sunlight, and certain viruses can elevate the chances of developing cancer. To safeguard our health, it's crucial to stay informed about these risks and make regular visits to the doctor for early detection. If you found this video helpful, please give it a thumbs up and share it with your friends. Don't forget to leave a comment and subscribe to the channel for more informative content.